Today's institute is entitled Basic Science Research Skill Development. It's going to be a fascinating day. I think you're going to learn a lot. We have a great group of presenters today. We start off with Dr. Amiya Sinha Hikim. He's an experienced researcher and has worked at various medical schools in the United States since 1985. He became a full professor at the David Geffen School of Medicine. And in 2010, he joined the Charlestown University faculty in the Department of Internal Medicine, University of Medicine and Science. He also has a dual appointment at UCLA. He's contributed to research in translational biomedical sciences. He mentors multiple students, including high school, undergraduate, graduate, PhD, and MD fellows and junior faculty. His research focuses on determination of cellular and molecular mechanisms that regulate hepatic and muscle steatosis, with a particular emphasis on the perturbation of fat muscle liver interactions in mouse models of nicotine and diet-induced obesity. The second area is elucidation of signal transduction pathways leading to hepatocellular apoptosis and the role in the pathogenesis and progression of hepatic steatosis to non-alcoholic steatosis, steatohepatitis. And his third area is in how in utero exposure of electronic cigarettes and high-fat diet perturbs cardiac structure and function in the neonates and adult offspring. Dr. Sinha Hikim has published 129 peer-reviewed articles, 1 book, and 14 chapters. He's a reviewer on for multiple journals, and he plays an important role in our SART Institute, our SART training program, including mentoring several trainees. Dr. Sinha Hikim's talk this morning is entitled Introduction Overview, and then will quickly be followed by Dr. Evans. Thanks everybody for joining today.
Thank you, Dr. Friedman. So,
oh, and sorry, Dr. Sinha Hikim, just
yes.
Before you begin, I just wanted to let everybody know that this is being recorded.
Okay,
and,
sure.
Yeah, just to let everybody know. Thank you.
Okay.
And
okay.
and also, perfect.
Good. So, here are some backgrounds of my today's talk. Now, research studies are designed in a particular way to increase the chances of collecting the information needed to answer a particular question. Carefully following the procedures and techniques outlined in the research protocol will increase the chance that the results of the research will be accurate and meaningful to others. Following the research protocol and thus the design of the study is also important because the results can then be reproduced by other researchers. The more often results are reproduced, the more likely it is that other researchers and the public will accept these findings as true. Additionally, the research design must make clear the procedures used to ensure the protection of research subjects, whether human or animal, and to maintain the integrity of the information collected in the study. So let's talk about a study topic entitled Additive Effects of Nicotine and High-Fat Diet on Hepatic Steatosis. For any given study, you should have introduction, objective or specific aim, hypothesis, methods, results, discussion, and conclusion. Now, the introduction serves multiple purposes. It presents the background of a given study, introduces topic and aims, and gives an overview of the paper. The study objective or specific aim is an active statement about how the study is going to answer this specific research question, which may lead to develop a research hypothesis. Research methodology is also an important part of the study, including experimental design, measurements of key parameters such as biochemical, histological, and histochemical, electron microscopic observations, Western blotting, statistical analysis. A carefully performed study should highlight the importance of the findings or results. The discussion section should include the major findings of the study, meaning those findings, how these findings relate to what others have already done, limitation of the study, and explanation for any surprising, unexpected, or inconclusive results. Every study should also have a conclusion. Please note that a conclusion is not merely a summary of the main topics covered or a restatement of your research findings, but a synthesis of key points and, if applicable, with suggestions for new areas of future research. So here are our introductions. What do we know? Cigarette smoking is the leading preventable cause of death and disability worldwide. It constitutes a major risk factor for cardiovascular disease, chronic obstructive pulmonary disease, and lung cancer. Mounting evidence also supports the notion that smoking can contribute to non-alcoholic fatty liver disease. Our group previously demonstrated that twice daily IP injections of nicotine, 0.75 milligram per kilogram body weight, blunted weight gain in mice fed with a high-fat diet. Nicotine treatment also led to a reduction in body fat on mice on a high-fat diet, as determined by both dual energy X-ray absorptions and computed tomography scans. So in obesity and other conditions where cellular lipid homeostasis is perturbed, lipolysis can contribute to ectopic lipid accumulation. Increased adipose tissue lipolysis triggered by combined treatment with nicotine and a high-fat diet would be expected to result in ectopic lipid accumulation in tissues such as liver and muscle. So here is our hypothesis. We hypothesize that nicotine plus a high-fat diet exacerbates high-fat diet-induced hepatic steatosis, in part because of increasing adipose tissue lipolysis. So to test the hypothesis, male C57 black 6 mice were fed either a normal chow diet with 5% fat or a high-fat diet with 60% of calories derived from fat. Mice on either diet received twice daily IP injections of nicotine or saline for 10 weeks. So this slide summarizes the effects of nicotine plus high-fat diet on alanine aminotransferase, triglyceride levels, GSH to GSSG ratio. Here, the data values are given, as you can see, as mean plus standard error of the mean, and means with unlike superscripts like A, B, C, unlike superscripts are significantly different. And we used ANOVA to assess the statistically significant differences among various treatment groups. If overall ANOVA reveals significant differences, post hoc pairwise comparisons were performed using two case studies. So as you can see, no significant changes in the ALT levels. ALT levels were noted among various treatment groups. However, compared with mice fed with a NCD diet, mice on a high-fat diet exhibited a significant increase in hepatic triglyceride levels after combined treatment with nicotine and high-fat diet. So to test whether nicotine plus high-fat diet induced greater oxidative stress, we measured hepatic GSH to GSSG ratio, which is inversely related to ROS levels. So when tested individually, nicotine and high-fat diet induced a comparably significant rise in oxidative stress relative to NCD mice treated with saline. When combined, nicotine plus high-fat diet caused a further increase in oxidative stress. So as you can see, the nicotine exacerbates high-fat diet-induced hepatic steatosis. So representative hematoxylin and eosine stained liver sections from mice fed with NCD without or with nicotine exhibited normal histological appearance. Compared with mice on a high-fat diet, where a modest increase in lipid accumulation was detected, combined treatment with nicotine plus high-fat diet causes a marked increase in lipid accumulation. The results were further confirmed by high-resolution light microscopy using glutaldehyde fixed, osmium tetroxide post-fixed, epoxy embedded, and toluidine blue stained liver sections. Now, glutaldehyde fixation followed by osmium post-fixation staining allows retention of fat that would have been normally washed out during tissue processing. So you can see a marked increase in fat in high-fat diet plus nicotine treated group. We also perform transmission electron microscopy to validate the results. Now these images, TEM, images of hepatocyte from mice fed NCD without A or with nicotine, exhibit normal ultrastructure characterized by numerous mitochondria, white arrow, ER, black arrow, and glycogen deposition, oval outline. In contrast, a representative hepatocyte from a mouse on a high-fat diet showed a modest increase in lipid accumulation compared with those from mice on a NCD. However, nicotine plus high-fat diet shown in D, E, and F caused a striking increase in lipid accumulation of varying sizes in hepatocytes compared with those from mice on a high-fat diet. So it is also important to know how nicotine plus high-fat diet causes hepatic steatosis. We know that AMPK, a central regulator of energy homeostasis, plays an important role in fatty acid metabolism through its ability to regulate key fatty acid biosynthetic pathway. So to investigate whether exacerbation of hepatic steatosis in high-fat diet fed mice by nicotine is associated with inactivation of AMPK, we carried out Western blot analysis to test the phosphorylation state of AMPK and liver lysates. Now, compared to mice fed NCD with or without nicotine, mice on a high-fat diet exhibited a significant decrease of phospho-AMPK. Combining nicotine with high-fat diet completely dephosphorylated, inhibited AMPK. The net effect of AMPK inactivation is decreased phosphorylation and activation of ACC, leading to increased lipogenesis in the liver. So we conclude the greater oxidative stress coupled with inactivation of AMPK is critical for the additive effects of nicotine and high-fat diet on the severity of hepatic steatosis in obese mice. Adipose tissue lipolysis is an important contributor to lipid accumulation in the liver. Although further mechanistic studies are needed, the data provide an in vivo demonstration of the detrimental effects of nicotine plus high-fat diet, high-fat intake on metabolism. Now, one of the key factors in the research is the reproducibility. So, in contrast to our study, where we have shown the detrimental effects of nicotine on the liver, others reported that in rats fed on a high-fat diet, high doses of nicotine, 3 to 4 milligram per kilogram per day, equal to 6 to 8 milligram per kilogram per day in mice, alleviate insulin resistance and hepatic steatosis via severe weight loss, negative energy balance, increased locomotor activity, and elevated brown adipose tissue thermogenesis. So why this discrepancy? Is this effect specific? So to address this discrepancy between mice and rats, Wu and colleagues investigated the metabolic effects of low doses, 0.8 milligram per kilogram per day equal to 1.5 milligram per kilogram per day in mice, and high doses, like what we used before, 1.5 milligram, and high doses, the other group of workers used 4 mg kilogram per day of nicotine in rats. Indeed, the low doses of nicotine, similar to our dose or the clinically relevant concentration found in smokers, induced insulin resistance, hepatic steatosis, and mild loss of body weight. Whereas the high doses of nicotine induce severe loss of body weight with improved glucose tolerance in rats. And they published these results in Nature Medicine.
Be about 2 or 3 more minutes, please.
Okay, so I'm almost done. So that is very important, the reproducibility of the study. And here how you can see how we were able to get into conclusions that actually, yes, these what we have seen, this is actually dose dependent. Thank you.
Okay. Thank you very much. Excellent. We move on.